Part 4. Let's move on to more antibiotics. Tetracyclines. These are bacteriostatic. Remember, they inhibit growth. They do not kill the bacteria. It inhibits protein synthesis. Wide spectrum activity against gram-positive and gram-negative. It also is effective against protozoas, mycoplasma, rickettsia, chlamydia, syphilis, and Lyme disease. Broad spectrum antibiotic, but it doesn't kill the causative agents. It allows your body to kill them. Chronic bronchitis, acne, periodontitis, gonorrhea, syphilis, anthrax, clostridium. So that's a pretty broad range of illnesses that tetracycline is used for. Tetracycline is an old medication. So these work very well. Now, it has a strong affinity for calcium. So it binds to calcium and magnesium and aluminum ions to form insoluble complexes. So in other words, if you take your tetracycline with a glass of milk, or if you're having heartburn and you pop some antacids, or you take your tetracycline with an iron pill, they will reduce absorption of tetracyclines. And so you never give tetracyclines with milk or any dairy products because they will lose pretty much all the benefit of the tetracycline. If you're hypersensitive, allergic, if you're pregnant, children should not take tetracycline. Severe hepatic and renal disease will be a contraindication. Now remember, discoloration of permanent teeth and tooth enamel in fetuses and children. So if you give tetracycline to a 4-year-old, their baby teeth will be fine, but their adult teeth will be stained. So tetracyclines are almost always not given until later years. And if it's taken during pregnancy, it may retard fetal skeletal development. So, teratogenic, right? Side effects? Nausea, vomiting, diarrhea, photosensitivity, and dizziness. Vestibular reactions. So, vertigo. It can cause an alteration in the gut flora, the intestinal flora, so you could get an overgrowth of E. coli. And that results in pseudomembranous colitis. And it can be very nephrotoxic in high doses. Remember, nephrotoxic, kidney, poison. So when you're giving this to your patients, teach them, can't take it with milk, iron, or antacids. Should drink it with 6 to 8 ounces of water. Avoid sunlight and tanning beds. If you're on warfarin, it's going to increase the effects of warfarin. So your doctor will need to order prothrombin or PT. And actually it's PT/INR. That's the test for warfarin. And you'll be checking renal labs, BUN and creatinine. Now there's aminoglycosides. These are bactericidals. They kill bacteria, and these are very powerful antibiotics, but they have serious toxicities. They kill mostly gram-negative and some gram-positive. So these are used on serious gram-negative infections like endocarditis, to prevent endocarditis, tuberculosis, hepatic encephalopathy. Now these have pharmacokinetics. Now remember pharmacokinetics, how the drugs move in the body? They are orally very poorly absorbed, but they're distributed widely. They're excreted through the kidneys about 90%, and they have a half-life of 2 to 4 hours. So how often do you think you have to take these? Remember, half-life is, say, 2 to 4 hours, and 5 half-lives it's gone. So in about 12 to 15 hours, most of the drug is gone. So you're going to need to take this at least twice a day. You're probably taking it 3 times a day. Gentamicin, streptomycin. These are some big ones. Neomycin. These are all different aminoglycosides. These have serious toxicities. They can cause renal failure. They have that ototoxicity and vestibular toxicity. The 8th cranial nerve, so you're going to be dizzy. You have to monitor drug levels, the peak and trough. Remember, how low it gets and how high it is. If the person has renal disease or they have neuromuscular disorders or heart failure, they're very old or very young, you probably won't be using these medications. The most significant side effects is not nausea, vomiting, diarrhea. Ototoxicity and nephrotoxicity are the most important. It can cause paresthesia, numbness and tingling, muscle paralysis, vertigo, skin rash, fever, and superinfections. So you're going to watch for all sorts of signs of ototoxicity: dizziness, tinnitus or tinnitus, and hearing loss. Push fluids, 1.5 to 2 liters of water a day. Watch for nephrotoxicity. You might have urinary CAS, proteinuria, or the increased BUN and creatinine levels. Fluoroquinolones is the next category of antibiotics. Broad spectrum, so they cover gram-negative, gram-positive, anaerobic, and tuberculosis. Now these, unlike aminoglycosides, these have excellent oral absorption, so you can take pills and get good results. Widely distributed throughout the body. Half-life varies by medication, 4 to 20 hours. And these are all excreted by the kidneys. So again, if a person has renal impairment or kidney disease, you have to be careful. Some of the quinolones, probably the most common that you've heard is Cipro. We've all heard of Cipro, right? Levaquin is a variation. These are all floxacins or usins. So ciprofloxacin, levofloxacin, gatafloxacin. In other words, if you see oxacin, it's a quinolone. That's an important thing to remember. Oxacins are quinolones. And these are good oral absorption, widely distributed, and they are gram-positive, gram-negative, anaerobic, and TB effective. They're bactericidal, though, so they kill the bacteria. And they alter the bacteria of the DNA, which causes the death of each individual cell, and does not affect human DNA. Think about the importance of that. Kills bacteria through changing their DNA. It leaves humans alone. Important. Good for lower respiratory tract infection. What's the difference between upper respiratory tract infection and lower respiratory? Upper respiratory, lower respiratory. Sinus infections, pneumonia. Bone and joint infections, infectious diarrhea, UTIs, skin infection, STDs, intra-abdominal infections, and anthrax. Haven't ever seen anthrax. Hope I never do. It just doesn't sound fun. So contraindications: severe renal disease, pregnancy, breastfeeding. You don't usually give it to children under 18 or the elderly, although you can, carefully. If a person has seizure disorders or renal disorders, we're always going to be careful. And theophylline, which is used for asthma, can cause toxicity. Some of the side effects: nausea, vomiting, diarrhea, as always. Seizures, headaches, dizziness, insomnia, arrhythmias. What does arrhythmia mean? Rhythm, and A means without. So it's going to make their heart beat without a normal rhythm. Pseudomembranous colitis again, anaphylaxis, and once again Steven Johnson. So, what are we going to teach our patients? 3 liters of fluid a day, unless the doctor says less. If you're giving tube feeding to your patient, that's going to impair absorption. So you may need to stop the tube feeding in between doses, so stop the tube feeding when you give a dose. Avoid antacids, milk, and yogurt because the calcium decreases absorption. Always check renal labs. You'll be checking renal labs with all antibiotics. Sunglasses, sunblock, protective clothing because of serious photosensitivity. If the person takes antidiabetics like metformin or glucophage, you'll want to watch for hypoglycemia. Hypo, low, glycemia, blood sugars. And this decreases the effectiveness of warfarin. Remember, which one increases the effect of warfarin? Do you remember? Tetracyclines. So tetracyclines make warfarin more active, or your blood will be thinner. Quinolones decrease the effect of warfarin, so your blood will be thicker. Either one, you're going to be monitoring the prothrombin time, or PT, pro time. Macrolides. Another broad spectrum antibiotic. This inhibits protein synthesis, so in low doses, these are bacteriostatic. In high doses, these are bactericidal. Some common ones: erythromycin, zithromax or azithromycin, and clarithromycin. So, mycins, macrolides. These work against most gram-positive bacteria. But again, severe hepatic disease, you probably won't give this. It's well absorbed through the GI system, a very short half-life, moderate protein binding, and excreted in bile, feces, and urine. So remember, what does protein binding mean? So if you take your macrolide, if you take your clarithromycin at the same time you're eating a hard-boiled egg, let's say, the protein in that egg is going to grab onto that antibiotic, and it's going to be harder for your body to absorb it. So, empty stomach. These can also increase the effects of many things, such as digoxin for your heart, oral anticoagulants, theophylline. So, you got to be very careful when you're on other medications. Upper respiratory infections, tonsillitis, pneumonia, skin infections, gonorrhea, chlamydia, and ear infections, otitis media. Side effects. I'll bet you'll be surprised when I say it's nausea, vomiting, diarrhea. Yeah. But it can cause some other ones that are a little different. Angioedema, chest pain, hypotension, and palpitations. Hypotension, low blood pressure. Hepatotoxicity. Now this is hepatotoxic, not just nephrotoxic. Jaundice and anorexia. Hearing impairment, leukopenia, not just thrombocytopenia, but leukopenia, and that's a reduced white blood cell count. Now imagine this: you're taking an antibiotic to fight an infection, and it makes your white blood cell count go down. That's a problem. These are highly protein bound, so they cause interactions with other protein bound drugs. Erythromycin absorption is improved on an empty stomach, but because it so often causes GI upset, frequently will be taken with a meal or a snack. And that's it for the PowerPoint. But come back for part 5, because I do have a little bit more to talk about.